Hi, I'm Mark Spence, and thanks for joining us. Well, Dr. Robert Jones is one of the top hair transplant surgeons, and he gets people from all over the world, and he's here to talk about some of his techniques. Thanks for joining us on The Source. Appreciate you taking the time to be here.
Oh, I'm glad to be here. Thank you.
First of all, let's talk about what are some of the medical indications to have a hair transplant?
Well, we can do hair transplants on different areas depending on the medical problem. Probably the most common medical indication would be a burn patient, and quite often after somebody's had a burn, there'll be an area either on the top of their head or on their eyelash or eyebrow that they've lost the hair, and you know, as long as they have a donor site, we're able to replace the hair that they've lost. So basically what we do is take the hair from the area where they still have some density and remove it, and we can dissect it under the microscope and plant the hair into the area that they need it, into needle holes. Now what it does is it thins the hair in the donor site, but fortunately you can do with losing about 50% of your density without really noticing any loss of hair. So we're basically, what we're doing is just spreading around the hair from an area where there's higher density to the area where there's been any sort of damage or injury. Now burns would be one indication. Also, if somebody's had a car accident, I've seen people that have hit the windshield with an eye and they've got a scar down the middle, and even on their upper eyelid they've got a scar and maybe lost a quarter or half an inch of hair on their brow and their upper eyelid. And it's quite easy just to take hair from the back of the head and transplant these areas.
Now, what if someone has alopecia? That's kind of tough, isn't it?
Well, again, they need a donor site.
Yeah.
I mean, if you take a look at the basketball player, Charlie Villanueva, who has lost all his hair, like that, he would not be a candidate for this procedure because there's no donor site. You know, unfortunately, at this point, hair cloning or hair multiplication isn't an option, and so unless we have a donor site, we can't transplant that patient.
Right. Now, how has it changed over the years? Like, when did they start doing hair transplants?
Well, I mean, transplants have been done since, really since the 60s and 70s. So the way it used to be done was large 3 or 4 millimeter plugs were taken out of the back of the head and placed on the top. And so at that point, patients would be left with kind of a doll's head appearance where they've got the big plugs in the front. It's what everybody sort of thinks of as the old hair transplants. You know, fortunately these days it's advanced to the point where we're doing it almost hair by hair, transplanting into the top of the head. So in fact, I've had one done. If you take a look at this photo, this is me. I had it done last February 20th, so this is taken about just about a year ago. So you can see, looking at the top of my head here, that how natural a hair transplant can look. And I mean, it'd be very difficult to tell, looking at me, that I had any work done without sort of me telling you that.
Yeah, it's incredible.
Yeah. So again, it's done hair by hair. So there's no, and as long as there's a good hairline design, and as long as you're not too aggressive with the hairline, it's very difficult to tell that any work is done. And even sort of checking out the hairline or the top of my head, it's there's no way that you can tell, again, because the hairs aren't put in clumps. They're put in what we call follicular units, which is just one, 2, or 3 hair grafts in the top of the head, which is the way they grow in nature anyway.
So is it painful?
Well, it's all done under local anesthetic.
Okay.
And even when we do an eyebrow or an eyelash, we just put drops in the eye to numb it up and put an eye cap in and just put local anesthetic. The patients are wide awake for the whole procedure. Or if we do the top of the head, we just use local anesthetic to numb up the top of the head and just make the holes with a needle, so it's painless. People drive home after the procedure. They wouldn't drive home if you did their eyes, obviously, after wearing eye caps. But if you're doing the top of the head, they can drive home afterwards.
Now, how long, well, let's say for you, for instance, how long did that procedure take?
It takes usually about 6 hours total.
Wow.
It's a fairly long and tedious procedure just because you're planting sometimes several thousand grafts. And so, like, you can't get a result unless you move a lot of hair. And in order to get a lot of hair, you have to dissect, again, 2,000 or 3,000 grafts and plant them into 2,000 or 3,000 holes. So to do that is obviously a fairly time-consuming procedure. So it's not like an hour or two. It can take, to do 3,000 or 4,000 grafts. This is another patient that we did. This is about 3,500 grafts. And to do something like this would take up to 8 to 10 hours. It takes a long time to get a result like that. And that's basically replacing pretty well an entire head of hair.
Right, right. So, and you said, well, you're at almost a year now.
Yeah.
So when did you initially, like, how long did it take for you to really start to see results?
After you do the procedure, it takes usually about 10 to 12 weeks before the hair starts to grow. And it takes up to a year to get full growth. So initially the hair will come in and will be finer, and takes a while. The shock of the transplant causes the hair to shed, and it takes about 2 or 3 months for it to start to grow, and then up to a year before it really reaches its maximum density and full shaft diameter.
Now, typically it's men who lose more hair than women, right?
Not true.
No?
You know, I would say probably 20 to 25% of the patients that I treat are females, and it's absolutely devastating in females to have hair loss. And it's a bigger and bigger part of my practice.